Assalamu alaikum everyone. My name is Ayesha Jawad. My department is BS Biochemistry. Today I am here to present the topic of cisplatin. So let's get started with the definition of cisplatin. Cisplatin is one of the most effective anti-cancer agents widely used in the treatment of solid tumors. It is generally considered as a cytotoxic drug which kills cancer cells by damaging DNA and inhibiting DNA synthesis. This medication is classified as an alkylating agent. Antineoplastic are cytotoxic drugs or medications used to treat cancer. These drugs come in many forms. Some are liquids that are injected into the patient and some are pills that patients take. Alkylating agent. It interferes with the cell's DNA and inhibits cancer cell growth. Cisplatin formula. Diamine dichloroplatinum. Here we can see the outline. Discovery define chemotherapy as related to oncology, types of cancer, synthesis, mechanism, uses, side effects, precautions, conclusion. Discovery. Bernard Rosenberg, University of Michigan, discovered cisplatin, which led to successful treatment for testicular and other cancers. Salary and growth. Chemotherapeutic agents for oncology. These agents are used to directly or indirectly inhibit the uncontrolled growth and proliferation of cancer cells. Oncology is a branch of medicine that deals with the prevention, diagnosis, and treatment of cancers. Kill tumor cells, doing as little damage to healthy cells as possible. Young tumors impair mitosis, trigger apoptosis. It is the process of programmed cell death. Here we can see the synthesis of cisplatin. Tertium tetrachloroplatinate is reacted with excess of tertium iodide. Tetraiodide form is reacted with ammonia to form a yellow compound. Insoluble silver iodide is precipitated as yellow compound, is treated with silver nitrate in water. Addition of the potassium chloride gives the final product cisplatin. Mechanism. It introduces the alkyl groups to the DNA. When repair enzymes tries to remove the alkyl halide fragments, they fragment the DNA. It binds with DNA and produces cross-linkages. It induces this pairing of the DNA, causes mutations in the cells. Cisplatin structure and mechanism of action. Cisplatin enters cells, hydrolyzed, forms highly reactive platinum complexes, intrastrand and interstrand cross-linkages. Intrastrand. Cross-linkages can occur within the same strand. Interstrand. These cross-linkages can occur between two opposite strands. DNA damage inhibits cell proliferation. Types of cancer. Carcinoma. Carcinoma are the most common type of cancer. It begins in the epithelial tissue or skin or in the tissue that lines the internal organs such as the liver or kidneys. Carcinoma usually form solid tumors, for example, lung cancer. Sarcoma and large leukemia. Cancers that begin in the blood, forming tissues of the bone marrow are called leukemias. Lymphoma. It is the cancer of lymphatic system, which is a part of the body's germ fighting network. Multiple myeloma. It is a cancer of plasma cells. Plasma cells are white blood cells that make antibodies that protect us from infection. Melanoma. The most serious type of cancer, skin cancer. It develops in the cells melanocytes that produces melanin, the pigment that gives your skin its color. Brain and spinal cord tumors, benign tumors, malignant tumors, other type of tumors. Head and neck, endocrine, breast, blood, gynecologic, skin cancer, sarcoma, gastrointestinal, lung cancer. Why not trans? Transpact rapid deactivation forms complexes towards faster than cis. Activity of molecular enzymes. 27% clearance in urine, not well understood. Uses of cisplatin. Cisplatin is a chemotherapeutic Chemotherapy drug used to treat testicular, ovarian, bladder, head and neck, lung, cervical cancer. Testicular cancer or malignant tumor that initiates in the testicles are most commonly found in men between ages 20 to 40. Treatment of testicular cancer by cisplatin and other platinum-based compounds has led to scientific breakthroughs such increasing the patient's survival rate. Common side effects of cisplatin is a risk of infection. This treatment can reduce the number of white blood cells in your blood, bruising and bleeding, anemia, the number of red blood cells, feeling sick, loss of appetite, changes to your taste, effects on the kidney, hearing changes. Precautions. If you can avoid people with infection, check with your doctor immediately if you notice any unusual bleeding or bruising, black pain stools, blood in urine or stools, or pinpoint red spot on your skin. Be careful when using a regular toothbrush, dental floss, or toothpick. Conclusion. Cisplatin. The cisplatin resistance of ovarian cancer is closely related to the expression level of P. follicle, which affects the prognosis of patients with ovarian cancer. Thanks.